everything is changing suddenly, and it's incredibly exciting. And when I say that, with the cost of healthcare finally reaching the breaking point where people have just said, we can't do this the way we've done it, with the passage of Obamacare, like it or hate it, sending a signal that it's not business as usual anymore, you are seeing enormous numbers of healthcare systems across the country, hospitals, medical clinics, that are finally beginning to ask, how do we make our system work better? How do we also change the way we're paid so we're rewarded for good results and not just rewarded for quality instead of quantity? And so there's a tremendous number of experiments. I'd call this our science project phase, where almost every hospital you go to is trying something to change the quality and results and safety of their care. But we haven't learned how to take the best lessons and make sure they spread widely. And that's where programs like the South Carolina Hospital Association, working with all of the hospitals in the state of South Carolina to be able to take the best lessons in childbirth, in surgical safety, in the safety of ICU care, and make sure that the simple, incredibly valuable lessons, whether it's a checklist or just a way of treating patients, gets to the front lines in ways that you can count on it as a patient coming into a hospital here. That is revolutionary. We're at the baby steps phase. I don't think we've done it. I think we've come a long way, and I think we're starting to see real results. But in surgery, where we've started to move this work, like bringing the checklist to South Carolina patients, as of spring of 2012, we're touching care that reaches about 70% of the patients in the state. But we haven't changed it for everybody in the state, and we haven't yet begun to see what you should see if everybody's really doing it well, which is seeing the decline in deaths and the decline in complications. We're just getting a hint that the bend is occurring, but it's just the beginning. So what's on the horizon is starting to be able to demand that the results change, that we do better than 60% of coronary artery disease patients receiving inappropriate care, do better than half of the complications and deaths that occur in surgery are avoidable. We know there's risk in surgery, but when half of the risk that occurs is because we just didn't do what already is known to be powerful, that shouldn't be. So I think what's on the horizon is going from science projects where individual places are just trying something in a scattered fashion to really starting to see in the next 3 to 5 years that we're changing practice. I've called it going from cowboys to pit crews. We've been hired, trained, and rewarded as individual practitioners to be cowboys, to go our own way, and that's valuable, but what we need now are pit crews.